Today we're talking about numbness in our lower extremities, our feet. Dr. Mervin, can you tell us a little bit more about this?
Absolutely. So there's a lot of symptoms people can experience in their feet: numbness, tingling, prickling, burning, shooting, stabbing, aching. And we are going to talk about what are potential causes of this. Again, remember, this is not for diagnostic purposes. This is just for educational purposes. Do not use this to replace your medical doctors. This is just for you to understand how the nerves work and what could potentially be going on. My name is Dr. Igal Mirman. I'm a board certified neurologist,
My name is Milana Mervin. I'm a registered nurse.
and this is what your doctor didn't tell you. So we are going to get started.
Okay, Dr. Mervin, can you tell us what are some causes of numbness in our feet?
Absolutely. So the most common one across all age groups is impingement of the nerve in the lower back. So
Okay.
typically the spine is numbered and lettered depending on the section. So the top of the neck is called the cervical spine, the mid back is the thoracic spine, and the lower back is the lumbar and sacral, so lumbosacral region. So when there's an impingement over there, those nerves are the ones that control the sensation in the legs. So if it's impinged in the lower back, that's where the symptoms could be traveling to the feet or to the legs.
Is it always both of them, and do they feel the same kind of numb?
Sometimes it can feel the same and sometimes it can be both, but not all the time. Typically in older individuals, it can be both. In younger individual, one side is going to be a lot worse. If something traumatic has happened, it's more likely to be one side versus the other, like an accident, lifting something really heavy. But most of the time in older individuals, it can also be because of arthritis in the back, and that process typically causes narrowing of the nerve roots on both sides similarly, and that's why it can be feel kind of symmetrical.
Okay.
Yeah.
Are there any like big red flags that we need to go to the hospital for if we have something related to numbness?
Yeah, I mean, if there is compression of the spinal cord, that'll cause kind of stiffness in the legs, difficulty with walking. The biggest red flag is having urinary or bowel incontinence, which
Mhm.
means you don't know you have to go.
But you go anyway.
Yep, you look down and it's all there.
Yeah, and it's not, like
Yeah,
you had a baby and you sneezed and a little bit came out. It's not like that. It's a little bit more dramatic than that,
yeah,
where you just not making it to the
yeah.
bathroom more times than you are.
And it's not just once, it's multiple times. It's sometimes it's not that you're not making it to the bathroom in time, it's that you don't know you have to go.
So what's going on in this process?
Yeah, so the spinal cord is getting compressed, so a lot of the nerves that are coming down that are controlling the sphincters and bowel and urine functions are disconnected, and so you can just have these accidents.
Okay, and that's something to go to the hospital for?
Oh, 100%. Yep, that's something you go to the
What is
hospital right away.
associated with it? Like, okay, let's say I have this incontinence that I don't know when I have to go. Any other symptoms that will kind of help
Those are
you?
this is the biggest red flag. Now, other things is
Mhm.
severe pain, other things is severe weakness, not being able to walk, and so on. But those are so we kind of moved a little bit away from nerve root
Mhm.
impingement to cord compression.
Yes.
Okay, cord compression is more severe. Can happen in the higher level of the lumbar spine, but most commonly happens in thoracic or cervical spine, and that can sometimes come with numbness, tingling in the feet, imbalance, falling, tripping, stumbling, so on.
Well, that's a really good thing to be on the lookout for. And let's get
Yeah,
back to our
yeah,
program and tell us a little bit more about what kind of treatments we can with associated with the first one that we were talking about.
yeah. I think before we talk about treatments, we need to talk about testing. All right.
Okay, that's yep,
So
that
so
makes
you're
sense.
having some symptoms. We need to figure out what's causing these symptoms. If there's a kind of clear signs that it's coming in from the spine. A lot of times it's an MRI. Depending on what the signs are, it'll just be the lumbar spine or it'll be the full spine, depending on what the symptoms are again. Um, the other thing is an EMG. EMG is going to help figure out where the damage is. Now, if the damage is spinal cord compression, the EMG will be normal. Okay, the EMG does not detect problems in the brain or within the spinal cord. That's all the central nervous system. EMG will be normal. If there's nerve root compressions or the nerve gets damaged afterwards, then the EMG will be abnormal, depending on how much damage there is. Okay, and that'll help us kind of figure out, is this because of the spinal root compression, or is there something else going on? At what level it's going on? So you'll be able to target treatment better. The treatment is variable depending on what they see on the MRI, how bad the EMG is, how bad the symptoms are, what exactly are the symptoms, what are accompanying signs. And it could typically be just conservative management, which means you have some pain and discomfort. They're going to treat some of that, whether with oral medications or interventional treatments, which would be epidurals and injections in the lower back where the nerve root is impinged. That, along with physical therapy to kind of realign the spine, stabilize the spine, increase mobility, and to increase the strengthening of the supportive muscles in the spinal column. Or if it's more severe, more red flags, compression is a lot more severe, then it's really a neurosurgical evaluation to see if you would be a candidate for surgery and whether this would be a good time for surgery or not. Yeah.
Okay. Anything else that you found in your research with numbness?
Yeah, so now there are other causes. Now this is one of them. There's another rare cause after the nerve roots. It's the plexus. The lumbar plexus can get injured. That's a very uncommon cause of numbness, and it's not just in the feet. It's really in the legs going down to the feet. And for that, you do need an EMG. You do need special MRIs, not just the spine, but also of the plexus. So as the nerves kind of leave the lower back and kind of go into the hip before they start going into the leg, they do have to image that to see as to what kind of damage there is. Is there something pressing on the nerves, or is this some sort of autoimmune process? But I think that is very, very uncommon. That we're not going to talk too much about it, unless for some reason we have a lot of people that have this. And the last thing is um, nerve nerve entrapment. That's not the last thing. And the next thing is nerve compression. So the nerve can get compressed around the knee, and that is called a fibular neuropathy. Can get some numbness on the outside of the leg and the foot and cause a foot drop.
Very
Yeah,
specific
very
symptoms.
specific.
Okay.
Yeah, it can
And
happen
foot
on one.
drop is when we can't really bring up our toes as
Yeah,
well as we
you
used to,
you
or us
can't
other
cock
people.
your ankle up, so you can't lift it up. Okay, so a lot of times people can trip, stumble when they're walking. Their foot just kind of slaps on the floor,
Or
uh,
dragging it a little bit.
dragging, slapping, um, and that can happen because of a lot of different causes. Some of them is when you're crossing your legs. I guess you can't really see that. If you cross it, you can kind of compress the nerve, and if it's vulnerable enough, you can. Yeah, so you're compressing the nerve on the outside, right over here.
And because
Um,
my other knee is going to go there.
yeah, and it can feel like you fell asleep, but if you kind of hold it for long enough, it can cause some weakness and a little bit of a foot drop. The other thing is when people lose a lot of weight, so some of the fat from there kind of
Dr. Merriman,
disappears.
are you telling us to not lose weight? Come on. All the other doctors say to lose weight.
Be cautious. So if you're losing too much weight, so a lot of times the fat cushions between the bone and the nerve, and if you lost that cushion, then the nerve can get compressed in the bone. So that's another potential cause of it. And we are not going to go into the rest of them again, unless a lot of people are commenting, talk more about fibular neuropathy. And the last one, and the most common one, is peripheral neuropathy. If you want to know all about peripheral neuropathy, we have a bunch of videos. But peripheral neuropathy is diffuse or generalized nerve damage. There are a lot of different causes for peripheral neuropathy. We've done a general video before, and we're going to do some in the future just covering each cause of peripheral neuropathy and how do we test for them and what do we need to do. If you comment about it below, we'll make sure that we move it up in the list. And for neuropathy, same thing as we talked about before. You need to do an EMG to see if it is a neuropathy. What type of neuropathy is it? Is it damage to the coating or the wiring of the nerve? So demyelinating versus axonal. And then once you have that figured out, we need to do some blood work to figure out what's causing the neuropathy. Again, all in that other
And
video.
that's a mess. There's other videos on that one.
Yeah.
Apparently, there's a lot that can cause it.
Oh yeah, there are a lot, and we're going to talk about each subcategory specifically in the future. And
it's interesting that even as a nurse, you just, oh, I have neuropathy, and some people just don't really get to the cause of it, and they just get treated all the same way. Is, in my opinion, is what it looks like from the outside. And it's really good to dive a little deeper and see what is the cause. Let's try to treat that.
So I've had a lot of patients, this is a little misdiagnosis alert here. I've had a lot of patients coming in with numbness in their feet, saying they've been diagnosed with neuropathy without any testing before. We do the exam, we talk to them, and I was like, I don't think this is neuropathy. It sounds more like an impingement in the lower back, and we do the EMG, and it looks like there's an impingement in the back. This is important because when there's an impingement in the back, we do things a lot differently. We do physical therapy for stabilizing the back and strengthening some of those muscles because that can help the symptoms and make sure it doesn't get worse. We can do targeted pain management, which works a lot better for that as opposed to the traditional treatment that we have for neuropathy. So you need to make sure that you have the correct diagnosis
to get the correct treatment, right?
Absolutely.
Seems simple, but it's hard to kind of dive in and investigate.
Yes.
All right, guys, if we missed anything, if we missed your specific diagnosis, let us know. If we didn't answer a question the way you wanted, or if you're very interested and want to learn a little bit more, you can comment that down below, but you can subscribe, follow, and so you can see the next video.